I'm not going to lie to you people. You're going to envy those who had vaginal birth, because those people are just going to be everybody. Welcome back to my YouTube channel. Yeah, so I'm continuing my pregnancy series. Once you wake up, you better expect to be in a load of pain, okay? Like, you're gonna be in pain. Like, when they say on a scale of 1 to 10, it's like, girl, that's a 10 over 10, okay? But yeah, the nurses is going to be there as soon as you wake up to give you your pain medication, and expect that you'll be on pain medication in the first 24 to 48 hours. Now, I'm not sure if it's the hospital I was, but sometimes they act like you're a junkie and you just want pain medication for no good reason. It's like people give the people their pain medication, okay, in the first 24 hours. It's ridiculous. Somebody is like, oh, you should be using tramadol, or what is that now, cocodamol. It's like, girl, I'm sorry, but it's like, come on, people, please. I don't know whether it's a nurse thing or doctor thing, but I believe that in the first 24 hours we should be giving our pain medication. Apparently, okay, so guys, let me share my experience with you. So I did my surgery around 9 a.m. Then I woke up around 2-3. I was given my pain medication, and then the next time I woke up again was about 9 p.m. And then after I texted a few people, oh, I've had the baby, you know, thank God for that. The day is blurry, honestly, I have no clue. And then I slept off. And so the next morning, Tuesday morning, I wake up and I'm in a lot of pain. And then the nurse is giving me attitude like I'm a junkie. It's like, girl, it's like, it's like, who am I? Like, are you joking? Like, I didn't take any pain medication except the one I took like literally the afternoon. And then she's like, oh, do you want pain medication? Then I'm like, yes, of course I do. Then I got the pain medication. Then at that point, I'm like, oh, can I feed my baby? She's like, well, you have to pick your battle. You want to feed your baby? It's like, what is this? Like, I don't know. Anyways, that was my experience. And for me, I didn't like that part anyways. Because I didn't know that if I took the pain medication, I could not feed the baby. So I just knew that when I woke up, I was in a lot of pain. So I need my pain meds. And she could have told me, you know what, maybe you should feed the baby first. But she's like, oh, you want a pain medication? And then I'm like, yes. And then she gave me, then I'm like, oh, can you give me the baby? Let me feed the baby. Like, oh, you have to pick your battles. It's like, okay, whatever. But I just ignored, okay? Yeah, so after I took my pain medication, that was like 6 a.m. I wasn't given any pain meds for the rest of the day, people. It was like, and then by evening time, and this was Tuesday. So on Tuesday evening, I'm in a lot of pain. And that will bring me to my second point of what happens after surgery. You're expected to walk, okay? You should try. It's very painful, I'm not going to lie to you, to walk after surgery. But from my experience and what I've also seen with our patients is the earlier you walk, the better for you. One thing I did was, because that Tuesday, when I woke up after I took my pain meds at 6 a.m., the nurse is like, oh, you need to walk. And boy, I was in a lot of pain. And that was like around 2 p.m. I've not taken any other pain medication, people. So I told myself, okay, that's fine. I'm going to try to walk. So I walked the corridor of the hospital where I was about 3 times. I told myself I'm going to do it 3 times and that's it. Like, I'm not doing this again. So it was difficult, people. So I did that 3 times. By evening, oh my God, like 6 p.m., I've not taken any pain medication, people, since morning. And at that point, I asked the nurse around 4, can I get, around 5, that, oh, please, can I get pain medication? And she's like, and then she kind of gave me attitude anyways, but maybe it's my head, I don't know, whatever it was, but I could not. Then she said, yeah, I'm doing that, I'll get back to you. Then finally, I just couldn't take it any longer, and I started to bawl. Like, literally, I was crying because I was in a lot of pain, like a 10 out of 10. And then when she heard I was crying, she finally came and said, oh, you didn't tell anybody since you want the pain medication. It's like, okay, if you'll say so, but whatever. Anyways, I would think that you guys would, when you're doing your rounds of giving medication, you would have asked, do you want your pain medication? Or you let me know whenever I need my pain medication, I should let you know, you know, so. But maybe I also assumed on my part that they were going to offer the pain medication. I either say I wanted it or I did not. But either way, so finally at about that 6 p.m. that day, she gave me pain medication and then told me, oh, after this, you no longer take the IV or IM, I don't remember which one it was, pain meds, that I should get the cocodamol prescription. So yeah, so I expect to be in a lot of pain, but the pain medication helps. And usually, honestly, I would tell you, after about day 4, you really don't well, okay, now let me just say this because everybody's different. In my experience, and even from my first baby, by day 4, I did not take my payments again. Okay, so like in this case, I am supposed to take payments like 3 times a day. So of course the Wednesday I took it all through, and on Thursday when I was going to be discharged, I only took it once. And the reason I took it was because I was going home and I also had another baby and I didn't want to be irritable, so I just took the payments. And also on Friday was the same thing, I just took it once and that was it. Okay, so but it's different for different people. So some people may need the pain medication for the entire 2 weeks duration or 1 week duration that the doctor writes it for, and some people might not even need it at all. So it just depends, but definitely the first 24-48 hours, yes, that is the peak of, I'm not going to lie to you people, you're going to envy those who had vaginal birth, because those people are just going to be rolling around the wards, you know, bawling with their baby. They can stand up, carry their baby, and you're just going to be like, oh my god. You're gonna be a lot of pain, but eventually it does get better, okay? So it's not that bad. But that's from my experience. So you'll be required to walk. Remember that the night before you're told not to eat anything, right? So so within 12 to 24 hours you can take liquids. Now with a C-section, there is not a lot of bowel manipulation, but some doctors like to be safe, so they might tell you not to eat anything for 24 hours, just take liquids. And some people will say after 12 hours, I mean, do whatever. If your mama were your baby via C-section, let me know what was the experience. Like, at what point were you told to eat? Was it after 12 hours or was it after 24? Oh, how long, like, did you have your first meal? So from my own experience, in my case, it was liquids. The first, you know, after 24 hours, then after that you could basically eat whatever. Yeah, so catheter would be removed also after 24 hours. So after the surgery they would leave it for that day, then the next morning if they see that there is urine, you're peeing, then they would take it out, and yeah, that would force you to walk by fire by force. Let me tell you my first experience, right? So because walking was very painful, I told myself I was not going to drink water. So that, I mean, I was going to drink water because they asked me to drink water, but I wasn't going to drink, because the first day I went to pee a lot and oh my god, it was so painful. So I told myself I was going to be restricting the water I was taking. I mean, I was on IV. So that I didn't have to go and pee. Like, like I was in a lot of pain. But the way my body works, or people, like whether you drink water or not, as long as you're taking IV fluids or whatever, trust me, you're going to go pee. And at the end of the day, I mean, it's still helpful because you need to walk, okay? So even walking to the bathroom is helpful, okay? So you're going to need to do that. The catheter is going to be out, so yeah, you need to go use the bathroom, okay? Also, coughing. Haha, who can relate to this? You cannot, I mean, coughing is very painful and very difficult. I never knew the first time, but what you do is when you want to cough, you use a pillow to hold that incision area and hold it up, and then you can, even with that, I still find coughing very difficult. So yeah, coughing is painful. Like, this is not the time to choke on water, people, or choke on your saliva. But it did happen to me. Like, I choked on my saliva and oh, I coughed like yeah, it was very painful. And this is not the time to watch comedians, okay? And if you have a funny friend, please tell them to get there behind you, okay? That is not the best time to crack you up, okay? Like, nobody like, especially the first 48 hours, that is not the time to laugh or to be cracked up, because trust me, you're going to be in a lot of pain. So if you have a funny friend, please, like, don't come near me. Like, I remember, like, I actually forgot myself on Thursday. While I was discharged, I was at home actually. So I went on Instagram and I saw a skit and I was watching it, and it was already starting to get funny. And then because obviously I was starting to laugh, and then I was feeling pain, and I just turned it off. Like, I cannot afford to laugh, people, okay? That is not the time for anybody to do anything funny, okay? So yeah, coughing is going to be quite painful, but what really helps is to grab that belly, okay, and cough. Then another thing is, don't expect to take a shower. Now, of course, this is very different in different parts. In some parts of the world, after 48 hours, you can take a shower, especially when they have those waterproof plasters. But on my part, on my experience, no shower for the first 1 week. That is basically before your stitches are removed. I remember after my first C-section, I mean, I never knew any of this, so I was so like, never, like I wanted to take a shower. I would always ask my doctor, like, can I take a shower now? Can I take a shower now? And ask my midwife, like my midwife, can I take a shower? Can I take a shower? It's like, no, girl, you can take a shower. You just have to wait. So I think knowing that helped with the second time around. So I knew I wasn't going to take a shower. The first day, like your first day postpartum, the nurses are going to help you, or the nursing aides, they're going to help you to clean your body. So they'll clean your body with your towel, and that's about it. And subsequently, again, usually by day 2, you should be able to do that by yourself. But again, everybody's recovery is different. So some people might still need help even 2 days after, and some people are just able to do that themselves. So, but no shower until your stitches are out. Listen to what your doctor says. Don't say that my friend that gave birth in so and so place, she took a shower, or she was just listen to your doctor's instruction so that you don't infect the wound and you can get your recovery as quick as possible. Okay, yes, you might be placed on antibiotic, but again, different practice for different doctors. So you might be placed on antibiotics just for a few days. Some people might place you on antibiotics for a week. Again, listen to your doctor and take it as prescribed until the last dose. Okay, typically you will be discharged after 3 days. Again, it's different from different people based on how you've been faring on the ward. And while you're on the ward, the nurses would always check your vitals. So they will check your temperature, make sure you're not having any fever that could indicate an infection. They will check your blood pressure, making sure you're not bleeding, check your heart rate, your respiratory rate. So all of this will be documented, I think typically every 4 hours, but again, depends on the hospital that you are in. The nurses are going to check your vitals regularly. So this would be done. If everything is fine, no problem, the doctor will check the wound. The wound looks clean, no signs of infection, no pus, no bleeding, nothing. Then within 3 days, so long, bye-bye, that's it. So like in my case, surgery was on Monday. By Thursday morning, girl, you can go. And trust me, I was so happy to leave the ward. Okay, like I love the comfort of my own. Yes, and so expect to be discharged. And when you get home, just take it one day at a time. One day at a time, sweet Jesus, that's all I'm asking of. So one day at a time, people. Don't stress too much. Don't be so concerned about, I'm sure you're even in a lot of pain to care, like whether the plate is washed or the floor. For those who are looking for ways to help a new mama, the video is going to be linked right here. Watch that video and can help ease the transition, postpartum. Okay, so just take it one day at a time. They always advise you don't lift anything heavier than your baby. Now, in my case, because I had another baby, like it's still a baby to me, okay? So like I had an older baby, who is a big bro, I know. Now what I do is, of course, he wants you to carry him. So what I do is I would always bend to his level, right? Or I would just kind of like assist him to climb up to the chair or to the bed. I don't carry him. I didn't carry him actually until at least 4 weeks, although they even advise like up to 6 weeks, so I don't carry anything heavy. Okay, so I didn't, at least for the first 1 month. So that's what I would do. I mean, I cannot push him away. I cannot say, go away, I don't want to carry you. So if I notice that, oh, he's coming to me, I would just quickly, get down to his level so we can hug and it looks like, he's in contact with me. Okay, so that is, guys, that is it. I hope it was not a long video and I hope you enjoyed this video. And if you did, you know what to do. Give this video a thumbs up and do not forget to subscribe and share. I mean, you just never can tell who this helps, okay? So share this with a mama, anybody expecting, or even just your friend. I mean, someday you might expect a baby, whatever it is. I'm blabbing, I'm rambling, I don't care.